Do you ever feel as if your future is outside of your control? It can be frightening to not know what comes ahead, especially when it comes to your health. However, a new study found that even a few adjustments to one's life can have a significant influence on cancer prevention. The 2022 study found that smoking, drinking alcohol, and being overweight are the top causes of preventable cancer deaths. Worldwide, nearly 4.5 million cancer-related deaths, about 45% of them, are attributed to behavioral risk factors like smoking, drinking, and sedentary lifestyle, said Sunil Kamath, Maryland, an oncologist. That's a much higher percentage than we'd previously thought. How do people minimize their risks of developing cancer? A ton of guidance is available. Information about cancer prevention is constantly evolving. However, it is well known that lifestyle choices influence the likelihood of developing cancer. Consider these lifestyle recommendations to help avoid cancer. Ditch the smokes. Each puff of tobacco has 250 poisonous substances. Approximately 70 of them cause cancer. And it isn't only lung cancer. Cigarettes are connected to 12 additional types, including the stomach, bladder, kidney, mouth, and throat. The quicker you stop, the better. Consult your doctor for help on how to quit smoking. Maintain a healthy body weight. More than half of all Canadians are overweight, which increases their chance of developing cancers such as uterine, pancreatic, breast, and liver. Our body weight can be affected by the amount of food we eat and drink, how frequently we exercise, our genetics, and even where we reside. We recognize that each body is unique, and we encourage you to consult with a healthcare practitioner to determine what a healthy body weight means to you and how you can achieve it. Take a light touch on alcohol. Drinking too many martinis every day increases your risk of developing cancer. Alcohol has been associated with a variety of cancers, including mouth, breast, liver, and esophagus. The more you drink, the more severe the risk. If you have a drink, do it in balance. Women should limit their intake to 1 drink each day, while males can have up to 2. Get off the couch. Do you spend too much time lounging? Cancer prevention is an additional motivation to begin exercising. Exercise reduces fat and hormone levels such as estrogen and insulin, which have been related to cancer. On most days of the week, aim for 30 minutes of aerobic activity to get your heart pounding. Put on a sunscreen. Tanning in the sun may give you a healthy appearance, but UV rays cause harm to the skin, which can lead to cancer. Because you can burn in just 15 minutes, apply sunscreen before heading outside. Choose a broad-spectrum sunscreen with an SPF of 30 or higher. Reapply anytime you sweat or swim. When you're exposed to the sun, wear a wide-brimmed hat and wrap around shades. Avoid toxic chemicals. Carcinogens are chemicals that damage the DNA in your cells and increase your chances of developing cancer if you contact, eat, or breathe them. Certain individuals come into contact with asbestos, radon, and benzene while working or at home. Chemicals included in weed killers, plastics, and some household goods may potentially be hazardous. You cannot avoid all chemicals, but you should be aware of which ones are included in the items you use and, if possible, switch to safer alternatives. Cancer risk. What the numbers mean. Take the time to learn about cancer risk and how it is monitored. This can help anyone put their unique cancer risk in a situation. You may question about your chances of having cancer. According to news sources, something new is discovered every day that significantly increases your risk. Sorting through all of the information and determining what's valid might be challenging. What is risk? When scientists discuss danger, they are referring to probability. Probability is the possibility of something happening, but not a certainty that it will. For example, whenever you flip a coin, there is a 50% probability that it will land heads up. The risk of cancer and other diseases is estimated by researching large groups of people. Researchers are interested in the likelihood that any individual or group of people will be susceptible to the disease over a given time period. They also search for features or behaviors that indicate an increased or decreased risk. How do cancer risk figures affect you? Risk statistics can be annoying because they do not indicate your cancer risk. According to some studies, American men have a 40% lifetime risk of having cancer. However, being a man does not increase your risk by 40%. Your unique risk is determined by a variety of factors. These factors could include age and habits, a family history of cancer, as well as the environment where you reside. Actually, cancer is dependent on the individual. Even if two persons have the same age, gender, race, socioeconomic level, and lifestyle, their experiences will differ. Chance statistics can be useful in broad statements like, exercising regularly can reduce the risk of chronic diseases, such as cancer. However, exercising regularly is not a guarantee that your body will not develop cancer. Consult your doctor about your risk of cancer. Your doctor can examine your lifestyle to see which factors may raise your risk. You can then explore how to minimize this risk in the future. Early cancer diagnosis focuses on recognizing symptomatic patients as soon as possible so that they can be treated successfully. When cancer care becomes delayed or unattainable, the chances of survival decrease, treatment complications increase, and care costs rise. Early diagnosis improves cancer outcomes by delivering treatment at the earliest feasible stage, making it an important public health approach in all settings. Currently, just 4 cancers are listed in the American Standard of Care, not including lung cancer, which is the greatest cancer killer. Early identification of cancer significantly improves the odds of successful therapy. Early identification of cancer includes 2 components: early diagnosis and screening. Early diagnosis emphasizes discovering symptomatic patients as soon as possible, whereas screening involves evaluating healthy people to identify those who have cancer before symptoms develop. However, never forget to take action as soon as possible, so you won't miss the most beautiful time life could bring to you. Now we have headed to the end of this video. Don't forget to share this video with your friends. Let's meet again with our next useful video.